Hello, everyone, and welcome back to Intimacy Behavioral Therapy. And my name is Rebecca Tarosian, and I'm going to address today an issue or a topic, I should say, that was unexpected to me when I first started engaging in this type of therapy with people. And it is a form of talk-touch therapy that helps people access the tools from within their bodies to be easy and find the ease and the discomfort when giving and receiving touch, and thereby overcoming many issues potentially that have to do with intimacy and sexual functioning, and gaining experience and confidence, and overcoming shame and many other hindrances that people find in trying to be comfortable in their own bodies and expressive with another person. So with that, this has to do with actually gender identity, hot topic these days, but as it applies to this therapy. So what I've found is that while yes, the majority of the people that I've helped are people or men who identify as heterosexual and also women, I've also had the privilege to work with people who are gender fluid or identify as gay or bi. And I was surprised to find out that what you would think would be obvious, that in order to engage in this kind of therapy, that a patient, you would need to be of the same orientation that I am, and or even be attracted, to me in order to do this work. And actually, that's not necessarily true, I've found, because the focus is on helping people, no matter what their orientation or attraction is, to, again, really become fully available to themselves and be able to bring forth the ability to replace anxious response and dis-ease in the body with greater ease and comfort. So this, while yes, for many people it may appear to be something that they wouldn't want to engage in unless they, for pure comfort level, felt like, I need to have these kinds of conditions ahead of time, including the therapist being of the same orientation, etc. It's not. I found that on a number of occasions I've been able to help patients that do not necessarily find me an attractive partner per se, or what else, or that they know coming in that they have a different gender orientation, so is this going to be a problem? And certainly isn't for me, because what I'm trying to do is help a person, no matter what that is, just really learn what they can learn so they can be happier, frankly. And so this was a discovery that I found in the evolution of this work, this therapy, that that this was not the kind of hindrance that I thought it would be if a person coming in is open and they don't themselves feel that way to start. Of course, it's always path of least resistance. So as I've said before, such a unique, specialized type of treatment that people who need it find me, self-select, outside of therapists and colleagues that refer people, but nonetheless, so personalized that a person kind of has to know for themselves. And if they don't know coming in, they soon will find out by the kinds of questions I ask, whether or not they're a good candidate for this, sort of regardless. So I just wanted to share that because I thought it was kind of interesting and again, maybe a bit counterintuitive than one would expect. So thank you for listening. Hello, everyone, again. And today's topic is women. Woman helping women. So up to this point, I've shared about my therapy and how it applies to helping male patients. And it's the majority of the people I work with who seek me out are men. However, I have worked with quite a few women that have contacted me because they are wanting to learn what I'm offering, and that is that they usually it's in a couple categories in terms of who reaches out to me, and that if you're a woman, it's because you are, frankly, you lack confidence, you're inexperienced, you're maybe even have had very little touch experience at all with another person, sexual or not, and have maybe even body image issues. There could be, so these are some of the reasons why women seek me out. Also, I've worked with women who have trauma in their bodies, stored from sexual assault, whether it was one time or multiple times in the past. Also, I've worked with both men and women who are veterans who are experiencing PTSD and have that kind of trauma in their body. But back to women, I have found that the way that this process unfolds, it works really well to help. I can, as a woman, I can help a woman, and that is, she's a person that really, it's you, really just wants to have a safe space to be able to explore these tools and learn about safe touch and how to experience it and find out what is happening in your body when you're giving and receiving touch. And it gradually becomes more intimate. And so that's an interesting point, because while with a man, if he has a problem with his penis, like an erection issue or the kinds of issues I've talked about before, which are pretty common, different kinds of erection difficulties or premature ejaculation or not ejaculating or a myriad of things, since women obviously are not bringing that problem in, those problems in, so when we get to a certain point in the work where I would be helping the man begin to apply the tools that he's learned to arousal navigation, I wouldn't be doing that in the same way with a woman. What I would be doing is there would be maybe some sexual touch that's applied so that they can practice with receiving and giving with ease. However, what I've found is that then once they've gained the kind of foundation and confidence working with me, I do my best to find someone. Sometimes they're male surrogate partners, or they're called sacred intimates, or different names, honestly. But there are a few out there, and what I would do is then recommend to the female patient I'm working with that they could reach out. I could, of course, introduce them, and then they could see if there's a comfort level, and I would be the go-between to let this other therapist know how we've been working and what they've learned, and then they could then practice, frankly, what they've learned in a more intimate, fluid way with this therapist partner, sacred intimate, surrogate partner, male. If in fact the woman, as I was kind of referring to the last, I'm making a connection to the last video. If the person is identifies as straight or heterosexual, then they would likely be comfortable with the male person to do the second kind of part to the work, and practice and get more comfortable in an actual experience. That said, if it's a woman who identifies as gay, then she may have a little bit more of a comfort level to work a little further with me, but at the same time, she may want to also, she may actually just, what I found is kind of end there, to be honest. Usually the women I've worked with as patients aren't wanting to explore that much more in terms of actually, just to be really straight, like going in and, with a woman obviously doesn't have, most, right, don't have a penis, so unless they're transgender, right, that's a whole other issue. But the the fact is that they really just need to work more on the lead up, if you will, of becoming comfortable in their bodies. And so the need to stimulate or to, they're not having those kinds of same functioning issues that men do. Now, that said, women do have vaginismus. They have a involuntary, which is like an involuntary kind of clenching of the vagina, and they've got like pelvic floor issues, and there are therapists that work with loosening that up and opening those muscles for those who are experiencing like some kind of sense of trauma where intercourse is painful. So there's other therapy routes, I should say, that they can go to look into that. So that, again, because I always keep coming back to the fact that my work is so much about the process of being comfortable in your body as opposed to anything that's directly sex related. It's as if in order to engage in sex, which is so goal oriented and fast paced, usually, the way of being in your body and being able to approach and even enter into kind of an intimate situation is where this work begins. So that a person can really just access the tools that they've learned and practiced, and when they're under the stress of the kind of very specific stress of anticipating an intimate encounter. So so it's been actually quite, again, eye-opening as well to be able to help women and who have honestly been courageous enough to seek me out and to be able to engage in this kind of therapeutic approach. So pretty wonderful, actually. So thank you for listening.